Good evening, everyone. Welcome to spring, and thank you for joining us tonight. Before we get started, I would like to read this brief disclaimer that you see on your screen. And it says, the PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. Now that we have that out of the way, I would like to introduce myself. My name is Craig Orpello, and I will be your host tonight. This is the PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your very own home. The PharmAssist program takes place every Monday at 7 p.m. Eastern. And tonight we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. And how is it interactive? Well, that is where you come in. You're joining us via Zoom or Facebook Live tonight. We invite you to be a part of the discussion by sharing your questions in either format, either in the chat or in the Q&A section on Zoom, if you wish. We are joined by various amazing HCPs each week from across the nation to provide you with a real-world fertility experience, just as if you were sitting across the table from the nurse in her clinic. And today we are joined by special guest Kaitlyn Endicott. So I'd like to thank you again for your time and interest this evening. And now I would like to turn it over to Kaitlyn. Take it away, Kaitlyn.
Great. Thank you so much, Craig. Hello, everyone. Thank you so much for joining us tonight. Like Craig said, my name is Kaitlyn. I am an IVF nurse in the Northern Virginia area. I hope that you enjoyed tonight's videos and that they help you to understand and gain confidence with your injections. We will be discussing 3 different medications this evening. We'll start out with the Gonof Multidose Vial, then we will move on to HCG, and then we'll end the night with Ovidrel. After each video, we will have time for a Q&A session, so you can type in any questions that come to mind while watching the videos, and we can certainly tackle them as we go. Please do keep in mind, I am so happy to answer general questions about the products or curiosities, but I am unable to answer specific questions, such as why you're on a certain dose of any given medication. Those are things I'll just say, I'm deferring to your healthcare provider on that. You're going to want to reach out to them to confirm. So with no further ado, I think we are ready to get started with our first medication, the Gonof Multidose Vial. Ready when you are, Craig. Instructions for the Gonof Multi-Use Vial. First, collect all of your supplies. So you will need your vial of medication. You will also need the pre-filled syringe that's full of saline or water. And you will also need one of the provided syringes. The medication will have a cap on it. It'll just pop off like this. You'll see the rubber stopper there. At this point, you can take your cap off of the pre-filled syringe. I recommend getting into the habit of taking an alcohol prep wipe to wipe off the rubber top of the vial. In order to compound the medication, you will just push your needle into the vial of medicine, inject all of the water into the vial. Once all of the water is in the vial, you can take out the syringe. It can go into your sharps container. And at this point, you have your medication reconstituted. Now you'll use this vial multiple times. So at this point, you can go ahead, take your syringe, peel it open. It peels open like a banana peel. And then at this point, I recommend pulling back on the plunger until you meet the dose that you're prescribed to by your provider. So for the sake of this video, we will use 150 units. So I pulled back 150 units of air and take off the cap, insert it into the rubber stopper, inject your air in, flip it over, and pull back to 150. If you get a little bit of air in the syringe, that's okay. You can push it back up and restart. So go back until you see 150. You can see I have it here. And then take out your needle. Now we want to go ahead and prep the site for injection. This is a subcutaneous injection, so pinching an inch of belly fat or pinching an inch of skin on the thigh are both appropriate areas for this injection. So once you've chosen your site, you will take an alcohol prep pad, clean the site off, let it dry, and then you will pinch that inch of skin and go in fast at 90 degrees like a dart. And then push the plunger, hold it for a few seconds, then take the needle out. You can get rid of the needle into your red sharps container, and you've completed the injection. Okay, so that was the Gonadolf Multidose Vial. This one is a good one because you only have to mix once, you get multiple doses out of there. So you're doing work one time, and from there on out, you're just pulling up your doses for subsequent dosing. If you require more than what's in just one of the multidose vials, then you'll just continue to do the same thing. So once that vial's empty, you'll reconstitute another one and just keep going the very same way. So you know, nothing's going to change. If you have, you know, depending on your dose, your nurse or doctor might order you multiple vials of those. It's just the same process every single time that you open it up. Okay. With that, do we have any questions rolling in quite yet, Craig?
Hey, how's it going? All right. Yes, we do have some questions coming in. The first one says, let's see. So I've read online about overfill. How does the overfill work to save me money? Speaking of saving money, what are the best ways to find out how to save on my various medications in general?
Yes, very good question. So with the multi-use vials, there's two different ones. One is a 450 unit vial, one is a 1050 unit vial. Each of these has 150 units of overflow or overfill of the medication. So what that means is you just continue to draw up your daily dose until you're completely out of the vial, like I said. Now, if you do math and you say your dose is 225, you have a 450 unit vial in your head, you're like, okay, that's 2 days dose. You get done with the second day and you see some left over. That's that 150 unit overflow that's left over. So hang on to it. You don't want to throw it away. That's definitely one way to get the most bang for your buck in terms of medications. You'll draw up whatever's left in there, roughly 150, and then reconstitute the next vial and draw up the difference to get to your dose. So if you're comparing the 450 and the 1050, you're probably going to save more money by getting multiple 450 unit vials because each of them has that 150 overflow. Whereas if you go with the 1050 unit vial, then you're just getting the one-time 150 unit overflow. So that's one way to do it. Another option is EMD Serono, which is the drug manufacturer. They have programs that you can apply for to see if you are eligible for any discounts on their medications. They have a compassionate core program for military and then also compassionate care. The compassionate care is income-based program, so it will ask for some sort of, I want to say it's a W-2 or pay stub, something along those lines that you will submit. They will review it, and they have different kind of brackets of percentage that you could be eligible to be off their medications, as much as 75% off depending. So you can always do that. That's at their website. I know that Mandel's works with that program often, so they would be a good resource for you as well, and then would also be able to implement that discount if you are eligible for any discount through those programs.
Yes, thank you. That's actually a great answer because part of what we do at Mandel's is we have financial counselors that can assist and walk you through these different programs. So to Kaitlyn's point, one of the great things about it is we will apply any program that you are eligible for. So you don't have to do all the heavy lifting to go search and look for it and figure out what you need to apply and all of that. We will assist with that throughout the process. So it's a great way to help you save money and to make sure that you're getting the best possible products for the most possible savings. So thank you very much. But yes, that's somebody right out of the gate trying to figure out how to save some money on these medications. That's a great
Yeah,
question.
it's a
We
must.
appreciate it. Thank you for that answer, Kaitlyn. All right. Just a quick reminder again, if you are joining us via Zoom, you can put your question either into the chat or the Q&A. And if you're on Facebook, you can just dump it right into the chat there and we will get everything. So speaking of, another question just came in. So let's see, this one says, all right, so I need some help with my upcoming cycle. What is the best way to store my Gonadolf between shots so I don't forget to inject it, but also keeps the medication safe? It's a great question.
Yes, very good question. So this particular Gonof, the multi-use vial, after it's reconstituted, I recommend keeping it in the refrigerator. Once it's reconstituted, it's good for 28 days from that point. Now, another good tip for this is to store the medication near something that will remind you every day to do it. So if your Gonadolf is supposed to be taken in the morning, put it by your coffee creamer or your morning butter cream cheese for your bagel, something like that. So that's right there when you're going to reach for those things that are already part of your daily habit. It'll remind you, and then before you know it, these injections will be part of your daily routine as well. If you have a medication that doesn't require refrigeration and it's room temperature, then you could put it by like your toothbrush or something along those lines. That's a good tip that I usually recommend, especially towards the beginning of the cycle when you're just getting used to that becoming part of your daily routine. By the end, you'll probably remember, but getting used to it and tying it in with those daily tasks that you do is a good way to start the habit of doing those kind of consistently every day. Very good question.
That's perfect. And those are all really good pro tips on how to remember. If you came to my house, you'd see I have like notepads, little sticky notes everywhere, because if I don't have something next to something else to remind me, I'll forget. So very important to find the thing that will help you remember. And then you kind of just follow it. Once you get it ingrained into your system, it'll definitely work out. So thank you for all those great examples, Kaitlyn. That's definitely very, very helpful.
Mm-hmm.
All right, so now we go from one end of the spectrum to the other, the minutia of how do I make sure that I don't forget my shot, very specific question, to the big question, which is what actual role does the Gonadolf play that would happen in a normal fertility cycle, and why do I need it?
Yes. So to your point, we want to make sure we're doing these meds correctly and at the same time and so forth. But as a patient, it's important to know why you're on these things and what are we expecting to get out of any given medication. So your Gonadolf is a FSH hormone, so follicle stimulating hormone. And what we're doing is we're giving you more than what your brain does in a normal menstrual cycle. So in a typical menstrual cycle, what happens is your brain will pump out FSH or follicle stimulating hormone. It does just that. It stimulates the growth of follicles. So within the ovary, we have follicles. Within the follicles are eggs. So in a typical cycle, the goal is to develop one mature egg. So brain is sending FSH to the ovary. We are producing one dominant follicle. Now in a IVF cycle, we are wanting multiple follicles. So we want to maximize our yield, get as many eggs as we possibly can and as safely as we can. So what we are doing is we're kind of overriding what our body does in a normal cycle, and we are pumping it up more. We're giving it more of what it's used to so that hopefully we're recruiting and getting a large cohort of follicles and eventually eggs within them that become mature. We go to egg retrieval and we have multiple eggs, not just the one that we see in a typical monthly cycle.
Perfect. Thank you very much. It's very comprehensive, and this is a perfect time to remind everybody. Hopefully you are not sitting at home frantically taking notes on all these questions, even if it's your question, because as we mentioned before, all these things are on demand. You can rewatch them later. So if you have a chance to kind of let the information soak in right now, and then you can go back and watch even just the little bite-sized video or the entire video itself to get the Q&A later on. So just so you can not waste your time trying to take notes and just listen and get a chance to hear some of Kaitlyn's great information she's going to share today. So thank you very much for all these great questions. It does seem like as of right now, we are all caught up on our questions. So We'll give another 30 seconds or so if people are trying to get that last question in. Always remember, even if you don't get in your Gonadolf question now, we will answer any questions later on for any one of the products. So don't feel like you have to rush, but I will throw it back over to you, Kaitlyn, as we get ready to move to the next product.
Great. So common, kind of comment, I guess you could say, that I get about the Gonof is the different modes it comes in. So we went over the multi-use vial. So it comes in vial form, and then it also comes in a ReadyJect pen. So it's actually a pre-filled pen, same medication, doing the same job. It's just in a different mode in terms of how you inject it. They're all subcutaneous injections. So pinching that inch of skin, small needle. So that's not going to change. It's just the way that the injection is done. So you may have heard of that before. Typically, if your provider doesn't have a strong preference, I know at the clinic I work at, we're fine with either one. So usually it comes down to either provider preference, patient preference. I've had some patients that have tried the pen one cycle, the vial the next, and just kind of mixed it up to see which one they prefer. Both are really easy, so you really can't go wrong, either way that you choose to move forward with this particular medication. All right, any last questions for this one before we move on to our next product?
I think we are all good for right now, so we are ready to move on whenever you are.
Great. So next up, we have the HCG. This is typically used as a trigger injection. It's one that occurs usually at the very end of a given cycle. So this is going to be one of those videos that'll be good to reference again towards the end of the treatment cycle. Like Craig said, this will be posted later. We also have the individual videos posted on their own on the page as well. So this might be a good one for you to go back, pull up, a half an hour before you're supposed to take this injection. So we are ready when you are. Now I'm going to show you how to prepare and inject an HCG trigger shot. So first, I recommend gathering all of your supplies. You will need an alcohol prep pad, your medication. It should come in powder form. You can see a little bit of the powder there. Your bottle of diluent, so saline or sterile water. And then you will need your injection needle. So this will be a 3 ml syringe with a 1.5 inch needle attached to it. So to start, I recommend taking off all of your caps. So there will be a cap on your powder that'll just snap off, and same thing with your diluent. Next, you can open up your syringe. So it'll peel open like a banana peel. This comes out. Then I would go ahead and draw back the amount of air that you're planning to pull up of diluent. So this can vary from practice to practice. At my practice that I work at, we recommend mixing with 1.5 mLs of the diluent. So I'm going to pull mine back to 1.5. Take off your cap. Then you're going to insert your needle into your vial. Push all of the air in, flip it over, and you'll kind of feel the plunger naturally pull back on its own. Make sure that your needle, and I'll turn it here, is in the actual liquid and not pressed up like this. Otherwise, you're only going to draw back air. So make sure you pull it down some and pull back until you have roughly 1.5 or whatever your provider recommends. Now you can see there I have a little bit of air in the top of my syringe here. You can actually push everything back up and start over. It won't hurt anything. So I'm going to pull back here. I have roughly 1.5. So now I can take this out. Now I'm ready to reconstitute my powder. So you have your powder vial. You see the rubber stopper here. The needle just goes right into there. Push saline in. And then give it a good little swirl. Helps things dissolve, but typically the powder dissolves just about instantly. Then you can flip it over. Again, make sure you pull the needle down so it's within your liquid. You can pull everything back. Now you're going to have roughly the amount of fluid that you put in. Some of it does get displaced when it is dissolving the powder, and that's okay. The most important part here is to make sure you get all of the liquid out of that vial. Once you have that, you now have your dose. You can take the needle out of the syringe, and now you're ready to prepare the skin site. So this is an intramuscular injection. So different from the subcutaneous injections you've likely done up to this point in your cycle. I usually recommend doing the upper outer quadrant of the buttock. So it's almost like the hip area in order to do this injection. So at this time, you can take your prep pad, clean off the skin site, let it dry, and then you actually want to pull the skin kind of taut when you do this to be sure that the medication gets to the muscle. When you're ready to inject, you go in fast, 90 degrees like a dart, and then push your plunger in. Take it out here, and you're all done. Okay, so as you could tell, this one is a little bit different. It's an intramuscular injection, so it's a longer needle than what we saw with our Gonof multidose. It has a different injection site as well. So we're not going subcutaneous either in the belly or outer thigh. We are in the kind of hip booty area where if you stand up and flex the glute muscle, you'll kind of feel it pop up. So that's the muscle that is the target for an injection like that. So you always want to be sure that you are double checking whatever medication you are doing. You want to make sure you're doing the correct route so that you can ensure that you have the right site and the right needle size. The last thing you want to do is mix up your needles and do either of those injections with the opposite needle. It's important to confirm all of those things before you go to do any given injection. Okay. I'm sure we have questions for this one with the intramuscular aspect of the injection that usually triggers some questions. So go for it, Craig.
I like that. Was that intentional when you said I'm sure it'll trigger some questions?
Yeah,
Yeah,
little pun there.
awesome. I like it. That's why you're the pro.
I
All right,
know.
let's see. A couple questions coming in here. So first off, I guess this is probably a good lead in considering that our next product you already mentioned was going to be Avidrol. And the question here is, I still don't really understand the difference between these HCG products that you talked about and Avidrol. Is there an efficacy difference or something else that I should know about?
Yes, this is a very, very common question with these products that I get on live a lot, but also at work. So typically I will say in the fertility world, the biggest thing that's going to be the determining factor between Avidrol versus one of the other HCG brands out there is going to be the dose or provider preference. So your Avidrol is much less of a dose compared to some of the brands of HCG that we can prepare as much as 10,000 units in any single vial. So you're looking at a major dose difference between the two. They are made slightly differently. I believe the Avidrol is made through recombinant DNA in the lab, whereas the other HCG products are actually made from urinary HCG. So slightly different there. I don't believe there's a strong efficacy difference between the two. They both act the same way in the body. But again, for the purpose of fertility, if there is not a strong provider preference between the two, it's usually going to be dose and price that's going to make the decision for you on these. They pretty much do the same thing. It's just getting the dose that you're ordered for will be the decider there.
Perfect. Thank you. Yes. And Mandel's, of course, will also be sure to help out and find out what your coverage might be for one versus the other to try to see, again, if there's not a strong preference and it's just kind of a toss-up coin flip, then we will help your clinic and you pick out the one that is most cost-effective for you moving forward. So just another little thing to know about the differences between the products. All right. So now let's get into some of the big questions too that we know always come up with any of the injectables for the trigger shots. It's about that time period, the importance of the time period. So the question comes in and says, what do I do if I missed my shot time? Is there any wiggle room at all, or am I definitely in trouble? Does this mean I'm going to have to start over? I'm a little bit nervous because I want to get it right.
Yes, this is a very, very common one that we get. This Let me preface this one by saying before you start your treatment cycle, I would ask your nurse or provider at what point in terms of how late you were, if you happen to miss this shot, are they concerned, and what they want you to do in that situation. So depending on how much time it is, they may have a different preference. You know, if you're 5 minutes late, I'm okay with that personally. Just do it, you know, as soon as you can. If you notice it's been 5 minutes since you were supposed to do it, go ahead and do it. Usually I say if it's been more than 20 minutes, go ahead and check in with me. Likely still going to be fine to go ahead and do it. But depending, you know, on how much time you are late compared to what they told you to do, they may need to move your procedure, whatever you're ending with, whether it's an IUI procedure or a egg retrieval. Depending on what that is, they may want to adjust the time of the procedure to account for whatever time you ended up doing the injection. I would also double check with your clinic if they have an after hours line or someone you can page to help you if this situation occurs, and if it's after hours, because they may want to, you know, if it's been too long, hours worth, they may want to see you back the next day and not have you trigger and see how things look. So this is very case by case, depending on how much time has passed. My official answer is to ask ahead of time so that you know what to do and what your clinic's preference is. I think it's safe to say if you're 5 or 10 minutes off, to go ahead and do it and just let your provider know, you know, that you were just a smidge late for that injection. Very common question that I get.
Perfect. Thank you so much. Now, more often than not, our hope is that you're asking these questions now so that you can get it right later. And hopefully by understanding what that wiggle room is, that is the trigger to remind you to make sure that you don't miss that shot. But it's also good to know that you're probably not the first person. If it does happen, you're not going to be the first person that they've seen. You're not going to be the first person in that clinic. And so it's always good to ask those questions, but know that you can ask and that you can reach out. And it's better to plan in advance so that when the time comes, you find ways to remind yourself, whether it is through your multiple different, you know, alarms around the house, or engaging maybe a partner or a friend as a reminder as well. Somehow you can, you know, remind yourself to make sure that you're on time. But thank you, Kaitlyn, for letting us know that there are alternatives, and sometimes we're not all perfect, and it's good to know just so you're prepared in advance. All right. So speaking of that last question, this question comes in and says, what exactly does HCG do? So you did talk about this a little bit already, and so this can maybe add a little bit more flavor. And because the second part is, obviously this question was being typed while they were listening to your last answer, because it says, why is the timing of the shot so much more important than any other product that we end up having to take?
Yes. So in terms of, again, you know, we want to make sure we're doing these medications correctly, but why am I doing it? So what HCG is doing for the cycle is it's actually causing ovulation. So it's giving the egg or eggs, depending on what type of cycle you're in, one kind of last boost of maturity. Like I talked about earlier, how within the follicles are eggs that are maturing and developing. When the eggs are developing within the follicle, they're actually hooked to the side of the follicle wall. They're attached. So if this is your follicle, your egg's attached there and it's getting bigger, bigger, bigger. And the HCG trigger is going to give it one last boost of maturity. And then it's actually going to cause the process of ovulation, which starts with the egg detaching from the wall of the follicle so that it's free floating within the follicle. If we were to not do any procedure, say you weren't ending with an egg retrieval and you were ending with an IUI, then we would like for that egg to then leave the follicle and ovulate. That's the goal. If you are doing an egg retrieval procedure, we don't want the egg to leave the follicle and ovulate. We want it to stay there, but we want it to be free floating in the follicle so that when we go in to aspirate the fluid from the follicle, that the egg comes with it. If the egg does not detach from the follicle wall and we aspirate that fluid, there's not going to be an egg to come with it. So that is why the timing is so precise. For an egg retrieval, we want to time it so that we are aspirating at that perfect time. The egg's free floating, it's available, and it's going to come out with the fluid. If you're too early, then it may be stuck on the side of the follicle wall still. If you're too late, it may have ovulated and left the ovary, and that's not going to do us any good either. If your ending procedure is an IUI, then we are trying to time it up with when the egg leaves the ovary for then fertilization to occur. So that's our goal there. So yes, most of your medications up till this point will have a general time of day to be taken. Try to keep those consistent daily. But this one is going to be super, super precise. Your provider is going to give you an exact time. It's super important to take it at that given time. So you can, set a reminder, sticky notes, alarms on your phone, all the gadgets and all the, the Alexas and so forth in your house. Those are going to be your best friend for reminding yourself to do these, and set it ahead of time too. So I usually tell my patients 15 to 30 minutes before. That way you can get everything out, prepare it, you can draw it up, have it ready to go. That way you're not 2 minutes before you're supposed to do it, which makes you nervous and things fumble and you drop things. You don't want that. You want everything to just be ready to go. That way when the clock strikes, you can go ahead and do it. Everything's prepped, ready. Very good question.
That is, thank you. That was an excellent answer. And I actually love that question so much because it really helps for people at home. If you're listening, if you're going through the process, or you're thinking about going through the process, or have a family member, whatever it might be, that question really does help you realize how amazing this whole process is, and how much is really going on, and how much that your nurse and your physician are handling to make sure that things go smoothly for you. So a lot of times we just, you just kind of think it's like, oh, take a couple of shots and then you get pregnant. And there's a lot happening behind the scenes. And this question is the one that really shows how tightly everything is working to make sure that it pans out and gets us to that end result that we want, which is to have a baby. So thank you. Excellent question and amazing answer. Definitely appreciate that. All right. And then this is one of my favorites, and I know you've answered it before. This is typically because people have watched movies or TV shows or anything like that before. So we can help put some of this to bed. But what is the risk with bubbles in my vial, if any? Should I be nervous? I've seen enough to know that potentially this could be very bad.
Yes, I knew what question this was when you said the movies, for sure. So, yeah, this is one of my favorites. Movies in Hollywood make it seem like the smallest of air bubble is going to be absolutely life-threatening. And hey, that's show business. They did their job, kudos. But in the real world, so small little bubbles are not going to hurt anything with these injections. Now, it would take a large amount of air being injected directly into a vein to see what you see in the movies happen. So rest assured there. Now, if you want to be thorough in terms of getting all the air out that you see, that's perfectly fine. I will show you how to do that. I actually have some here. So again, we'll do 1.5 mLs. You're going to put your needle in, push the air in, hold back. All right. So once you have your solution in, if you notice little air bubbles and so forth, you can tap around. Some little ones, it's very common for them to be around the plunger down there. You can flick at them. Sometimes it works, sometimes it doesn't. Those little ones down there won't even make it out the needle. That's how small they are. So don't worry about those as much. But what you can do to ensure that your needle is primed, meaning that there's fluid from here all the way through the needle, so there's no air, you can actually push up on this guy, and mine is a little finicky here. So I've used it before. Okay, so you're going to push up until you see little air bubbles come out, or little bubbles come out the top. That's how you know that you have fluid from start to finish through. So if you want to be thorough and do that, it's good practice. But in the event that you have small little air bubbles around the plunger or right kind of in the hub here, it's totally fine. It is not going to hurt anything. So don't stress out about that part. If anything, just pay attention to make sure you're doing it at the right time. That's your biggest worry.
Perfect. Thank you so much. Yeah, I blame daytime television shows for that. That freak
Yes.
people out about it. But thank you. That was a great answer, and hopefully, put that to rest for anybody at home. So you're not worried about that part of it. There are things to think about. That is not one of them. So it's great
Yes.
to know that you don't have to worry. Um, with that being said, I think we're all caught up on questions. So I will throw it back over to you for, like we said, another 30 seconds or so. Give people a chance to put in any last questions before we move on to our third and final product of the evening.
Excellent. So again, this injection is very different, intramuscular, so it can be a little bit more intimidating. Really, the biggest part is placement of this injection. So, I would ask your provider what resources they have for you to ensure that you are doing it in the correct placements. For my patients, we have diagrams, but most oftentimes we offer to draw circles, on the hip area as to where's the very best spot to do it. It's one less thing to think about when it comes time to actually do the injection. As long as you don't mind having a little bit of Sharpie on you, then I think that's a good way to go. But I would definitely ask your clinic, what they can do to make sure you're doing it in the correct placement. And I'm sure that they have resources, because that's a common question that I always get is, how do I know it's in the right spot? So upper outer quadrant of the buttock. So if you have a pair of jeans on and you put your hands back in the back pockets, kind of where your thumb hits on the outside, that's a general good rule of thumb there for the correct area for the injection.
All right, I think we are actually good to go. So we can move on to that third product. And again, just a reminder, if you think of any questions or questions here, because obviously these two products are pretty closely related. So if you think of a question that relates back to an earlier product, by all means, throw it in the chat and we will definitely get to it. But take it away, Kristen.
Perfect. So last but not least, we have Avidrel to finish off our night. This one is a pre-filled syringe. It's ready to go. The medication's in there. The needle's attached. So usually this is one that I find that a lot of my patients feel pretty confident with. It's a good one that I usually start out with IUI and timed intercourse patients. It's their very first injection typically. So this is a good one to get going with. Not a lot of work in terms of mixing. It's just mustering up the courage to actually inject that medication. So we are ready when you are, Craig. Now we're going to review how to do an Avidrel subcutaneous trigger shot. Now the shot will come in a box that looks like this. It's all pre-filled, ready to go for you. No mixing, the needle's ready. So this is generally just how to do a subcutaneous shot. So you'll need your supplies. You'll need your injection. So you can see it here. You also need your alcohol prep pad, and that's it. So since the shot is ready to go for you, really what you need to do is select your site for injection. Now, subcutaneous injections can be done in multiple places. I would confirm with your healthcare provider where they want you to inject. Generally, I recommend either the abdomen or the thigh tissue. Really anywhere that you can pinch an inch of skin is fair game. I think most of my patients end up doing the abdomen, but it's up to you. So once you have chosen your site, you will open your alcohol prep pad, clean the area, let the alcohol dry, and you will take your injection, take the cap off, and you will see the needle there. Now, if there's a little bit of air in there, you can always press it up to get rid of it. Otherwise, it's pretty much pre-filled for you. Then you will pinch an inch of skin, so that area that you prepped, pinch that inch in fast, 90 degrees like a dart. Press the plunger. Hold it for a few seconds, then remove. At this point, this can go straight into your sharps container. No need to recap it to risk sticking yourself. And you've completed your Avidrel trigger injection. Okay, so again, another type of HCG trigger injection. Of course, different from HCG, where this one's subcutaneous, ready to go, no mixing. So it's definitely convenient, but your dose is going to likely drive which one you are going to be doing for a given cycle. Sometimes that is decided based on how many follicles you have. So many times through a timed intercourse or IUI cycle, you may see the Avidrel used, whereas an IVF cycle, you'll see the HCG. But again, that's going to be provider preference, so they'll be the best ones to confirm that for you. Any questions about Avidrel at this point?
Yes, first thing I just want to say, what a pro you are, because I accidentally, and I have no idea why, but I accidentally said Kristen when I said take it away, and didn't say anything, and that's what a pro you are. I blame it on COVID. It's like COVID brain. You get stuck in your house too long, and I'm literally staring at your name on the screen, and you're like, still just made up a name. Sorry about that.
You're fine.
Kaitlyn, here we go. So a question came in that said, some fluid is evident on my skin after I pulled the Avidrel needle out. Is this going to be a problem? Does this have a problem for any other products as well? Am I doing something wrong?
Yes, so this is actually very common, typically not an issue with subcutaneous injections if a little bit leaks out after. A few ways that you can help combat this. You can, once you've put the needle in, injected your plunger all the way, hold it there for 2 or 3 seconds, then pull it out. That might give the medication a little bit more time to kind of disperse within the tissue. You may also be holding the skin pretty tight, which may or may not have an impact on this problem. Once you're pinching that inch of skin, like I said, and you're holding it, maybe just not hold it, super, super tight. That might keep things from, dispersing appropriately. But usually if there's, a small little drop that comes out, in regards to your dose, that's a very minuscule amount. It's very common. It's not something that I would worry too much about. If you try those remedies and it doesn't take care of it, it's very common. Just have a sterile gauze at hand so that you can wipe it up, and you should be fine to move on.
Awesome. Thank you very much. I think a lot of times we just want to be ahead of these potential issues. And so these questions are great because it allows you to be prepared if something happens, and you know why. You have the reasoning behind what is something to get nervous about and what is not. So that's definitely a great answer, because it helps to put people a little bit more at ease. Just similar to this next question, which says, I'm about to take my first Avidrel shot ever, and I just want to be prepared. What are the biggest side effects associated with Avidrel, and what are the best ways I can treat them, whether beforehand or after the fact?
Yes, great question. So let me preface this one with saying that most times this is a very well tolerated product. I rarely hear about any side effects from my patients with it. So, rest assured there. If I do hear about a side effect with this one, I would probably say the most common is kind of upset stomach or nausea. You can space out your meals. So eat small, frequent meals, avoid fried and greasy foods. You can eat light, bland foods like bread, crackers, that sort of thing. But like I said, usually this one's going to be pretty well tolerated. But what it's doing is it's causing that ovulation to occur. And then, depending on if there's pregnancy or what the end goal is, you may have that kind of crash in hormones. So, it may not be something that's directly from the Avidrel, but it may just be something from the hormonal effect that's actually causing down the line that you're experiencing. But like I said, usually this is one that patients find pretty tolerable. It's pretty easy to do. And, it's not something that they're extremely nauseous or have bad headaches or anything like that from.
Awesome. All right. Sounds good. And then we have a question coming in, and I'm actually excited to hear what your answer is to this one, because this is actually a new one that I have not seen yet. It says, does it matter if I give my Avidrel shot myself, or can I have my partner help? He really wants to help.
Yeah, absolutely. Have that
Hey,
at-home
shout
nurse
out
help
here.
you
Finally.
out.
Look at that guy. Good guy.
Yeah. Yeah, utilize your at-home nurse. Absolutely. So yes, you can absolutely have your partner help you. Again, it's going to be the same options in terms of injection sites, the outer thigh, the belly. If you have someone else that's willing to do it for you, you kind of get a third option, which is the back of the arm. So the reason that I don't usually say it kind of in my normal spiel for a subcutaneous injection is because if you were doing it yourself, you would need a third hand to get back there because you got to pinch that inch and then give it. So that would be another option. Some patients like that better to have their partner do it and then they don't see it. You know, if you're not a huge fan of needles, then you can do that and you never have to see the needle or be tempted to look. So absolutely, you can have a partner help with that and it gives you that extra potential injection site. So yes, that's a good one. I think that's the first on here for that one.
Yes, I like it. No, that's great. I like that this guy is actually at least asking to help, which makes
Yeah,
me happy.
absolutely.
So, great answer. Thank you so much. It does look like we have wrapped up in the questions that we had coming in for Avidro. So as before, now that we've kind of wrapped up through all three products, we'll give a little bit extra time for anyone. If you have any questions about any one of the three, or if you have even a little bit of a basic fertility question that you just want to ask, now's a great time to ask it. So I will throw it back over to you, Kaitlyn, just as we give people another 30 seconds to a minute or so before we begin to wrap up the program tonight.
Perfect. So just an overall tip that I like to share, and I kind of alluded to it earlier, is with these products, there's usually two things that, impact the cycle. It's the nerves with actually doing the injection, and then there's nerves of forgetting to do the injection. So we have all of the resources for you to actually physically do that injection and get it done. Now, remembering it, that's not something we can do for you. We can't pop into your living room and remind you. So I can't stress enough to work smarter, not harder. So use your alarms or calendar apps on your phone, use your in-home devices, sticky notes, whatever is going to be best for your day today, to remember to do these things, aside from just having to remember at a certain time every day. So if it's where you're putting your medication, if it's your partner reminding you, maybe that's their job. They're setting an alarm on their phone and then they're coming to find you to do it. That's something that I would definitely get creative with. It's one less thing you have to think about. It does that work for you. And then the only thing you have to worry about is physically getting the injection done. So that can kind of take away some of the anxiety and pressure of the cycle, is having something else track that part of it for you. And you just have to know to do it when you hear that bell go off. So definitely a good tip for during your cycle. Any other questions at this point before we wrap things up?
No, I think we have gotten through all the questions. So you did a great job. You answered everything proactively for most people, it looks like.
Perfect.
I think we're good to go. We can wrap up tonight. Thank you so much.
Sure. So thank you all so much for joining tonight. I hope that these videos help to put you at ease, make you feel more comfortable with your injections, and hopefully we got ahead of some of the questions that will come down the line so that you're even more prepared for when this time comes for you. Just another reminder, you can find all of these videos, the pre-recorded sessions, tonight's live sessions, past live sessions, they are all available to you online at the PharmAssist website, as well as the YouTube page. So you can find all of those for you to go back and view at your leisure in the future. I usually recommend pulling up either the live sessions or the individual videos before you're about to do your first injections for those first couple of days. It'll help you kind of get that rhythm. And then once you have the habit, you'll be able to do it without the assistance. So thanks again, everyone. That's it for me. I'll give it back to you, Craig.
Awesome. Well, thank you so much. First off, I definitely want to thank you for doing such a great job. Thank you so much, Kaitlyn, for your time, your expertise tonight. I'm going to just keep saying Kaitlyn so that everyone remembers that I know your name and that I've done this before with you. So Kaitlyn, you did an amazing job. Thank you. I want to thank everyone who joined us via Zoom or Facebook Live for sharing all of these excellent questions. We hope that you were able to learn something tonight. And kudos to that one person who gave us a question that we had not seen yet on the program. So you won tonight. Do not forget, as Kaitlyn mentioned, that all of these videos, the full virtual learning experience, or VLEs, which is this full video we did tonight, as well as the individual product videos, the demonstration videos that Kaitlyn used, are available on demand at YouTube, Facebook, and mymandelspharmacy.com/PharmAssist. We have to keep reminding people of that because they say repetition leads to retention. So we'll just keep reminding you, you can find those on demand as well. We definitely look forward to seeing you all here again next Monday night at 7 p.m. Eastern Standard Time for another great program. If there's more information that you can learn from this, we'd love to see your questions again. But also, just like everything else on the internet, the way that people find out about it is share, share, share. Please, if you have a friend, a family member, a colleague, somebody that is a colleague of a family member and a friend, any of those combinations can be great. Let them know about the program, because if they can learn from something that you already learned from, that's a great way to share and help people go through this cycle together. So we just want to say thank you so much again for your time. Thank you, Kaitlyn, for making time for us again tonight. And we look forward to seeing everybody again next Monday. Thanks again. Good night, everyone.